Queensland, Australia, March 15th, 2018.
Alright, miss, I'm Dr. Wombat here. What seems to be the problem?
Well, I was snorkeling in the coral reef and a shark bit me.
Oh
And now
my
I'm
gosh.
bleeding and I can't get it to stop.
Yeah, that's a lot of
So I thought I should come in.
Yeah, that's
Yeah,
a lot
I took an Uber here.
Oh gosh, okay.
Mhm.
Do you take any medications every day, or?
Yeah.
Okay, what do you take?
Ooh, well, I take 3 of them. One of them's yay big, it's green, has like a weird shape on it, design, looks like a rainbow kind of. And then another little white one, and then one of those clear ones. You know, if you squeeze it, the liquid comes out.
You don't know the names at all?
No. I just take them, and then when they're done, I get more,
Do you have any health history? You know, what illnesses do you have? What are you taking your medications for?
I don't really remember. It's been a while since I saw a doctor.
Have you had any surgeries in the past?
I had my wisdom teeth out, yeah, when I was younger.
Okay, that's it?
Mm-hmm.
Too bad you don't have a personal health record.
Now you're probably wondering what a personal health record, or PHR, is. Did you have an immunization record like this growing up? If you did, you already had a personal health record. A personal health record is simply a collection of personal health information. It can be as complex as an electronic personal portal or as simple as paper copies of health information. You've probably heard of an EHR or an electronic health record. An electronic health record and a personal health record are different. An electronic health record contains information that is gathered by clinicians in the clinic or hospital setting. It goes beyond standard clinical information to include a broader view of the patient's care. It might contain clinical notes and laboratory results for multiple healthcare providers to view. A personal health record is set up to be accessed and managed by the patient. There are 2 types of PHRs. Standalone PHRs, the patients enter their own information. These personal health records can accept data from other sources, such as if you use the Health app on iPhone, you can connect it with your Mayo Clinic app to import information from your latest visit. Another example of a standalone PHR is MyFitnessPal. With this app, patients can input their food, exercise, water intake, and track their weight over an extended period of time. A low-tech version of a standalone PHR would be a medical alert bracelet or medical information card that you store in your wallet. The second type is a tethered or connected personal health record. These are linked to a specific healthcare organization's electronic health record or health plans system. Some tethered or connected PHRs allow you to add your own information, such as home blood pressure readings, while others do not. An example of this would be the Mayo Clinic patient portal. Now let's look at some advantages and disadvantages of personal health records. Some advantages are electronic personal health records are easily accessible from anywhere via smartphone or computer. They can be customized to the patient's specific disease, needs, and knowledge base. It changes the encounters between providers and patients from episodic to continuous, therefore lowering communication barriers. It can help lower healthcare costs by providing other forms of communication, such as patient portal messages, instead of having a clinic appointment. If the PHR allows patients to enter their own information, it gives providers more data to make clinical decisions. Patients who use PHRs are more engaged in their care and have improved compliance. Disadvantages include tethered models that are connected to a specific healthcare facility may not be portable if you move to a different hospital or organization, creating an environmental barrier. There are also legal implications. Providers worry about treating patients based on inaccurate patient-entered data. PHR vendors have also been met with financial and marketing barriers, and several companies have gone under. There's a need to embrace the new style of patient-provider relationship and build trust this way. Now that you have a better understanding of what personal health records are and the benefits, what should you include in a personal health record? Well, it should really be anything that helps you and your doctors manage your health. But generally, you should include your doctor's names and phone numbers, allergies, your medications including dosages, lists and dates of illnesses and surgeries, chronic health problems such as high blood pressure, living will or advance directive, any pertinent family history, and your immunization history.
The study of personal health records has been driven by the increased usage of PHRs in society. According to Kim et al.'s 2011 publication, History and Trends of Personal Health Record Research in PubMed, PHRs first appeared in a German academic journal in 1969. PHR, in a historical context, represents a simple form of notes containing information one needs in order to be informed about one's health. Early studies on PHRs focused on these paper records. Over the years, research related to PHRs has shifted to patient-centeredness, consumer needs, and mixed usage or tethered models. PHR research is less focused on its use for patients with specific illnesses, but rather its role as a health management and promotion tool. In Archer et al.'s research article titled Personal Health Records, A Scoping View, they reviewed studies related to personal health record research. PHR articles and study types focus on system attributes, purposes of PHRs, and adoption, acceptance, and usability. Some of the barriers identified within the literature with PHR adoption involve age and socioeconomic status disparities, which affect access and understanding of technology-driven PHRs. The most frequently used methodology for PHR researchers is the survey method. Studies involving qualitative observational methods are also commonly used. There is little solid evidence from randomized controlled trials or other studies of proven effectiveness in improved patient health outcomes through the use of PHRs. Personal health records are ever revolving, as is the direction of personal health record-related research.
Now that you know what public health records are, I'm going to touch on how all that information is protected within them. PHRs offered by healthcare providers and healthcare plans are covered by the Health Insurance Portability and Accountability Act of 1996 Privacy Rule. These entities are known as HIPAA-covered entities. The HIPAA Privacy Rule regulates how information is held, safeguarded, and used in these PHRs. PHRs that are offered by HIPAA-covered entities will contain protected health information, and thus the covered entity must appropriately safeguard this information as required by the Privacy Rule of 1996. The Privacy Rule protects the privacy of certain identifiable health information, known as protected health information. The Privacy Rule also governs how these covered entities may use and disclose an individual's protected health information, and grants individuals certain rights regarding their own information. Any entity that is covered by the Privacy Rule may establish privacy policies that restrict its uses and disclosures of such information beyond what is required by the Privacy Rule. PHRs that are directly available to us by private vendors are not HIPAA-covered entities, and therefore are not protected by the HIPAA Privacy Rule. These types of public health care records are governed by the privacy policies of the specific entity that offers them, and may be governed by other laws other than the Privacy Rule. Although some of these personal health care records may advertise that they are HIPAA compliant, the Privacy Rule does not apply to or protect any of the healthcare information within them. When selecting a PHR, patients should evaluate the privacy rules and policies that pertain to each and decide if they are comfortable with the protection that is being offered, how their information will be safeguarded, and in what manner their information will be disclosed or shared with others.
As nurses, what can we do to ensure our patients receive the best possible care? We can educate them on the importance of using a personal health record. A PHR can serve as a comprehensive health history, allowing for a more holistic approach to care. Nurses are in a prime position to influence patients on the use of a PHR since they provide a large portion of direct patient care. Patients can also rely on nurses to decipher difficult to understand health information. PHRs encourage involvement and give patients opportunities to engage in their own personal health and make informed decisions. Using a PHR, patients gain autonomy and control over their own health. Anyone can use a PHR, and nurses are instrumental in promoting its use. Nurses should stress the importance of having a consistent and accessible record regardless of acuity. Using a patient portal, patients can easily initiate an online message and receive feedback quickly. The more we can involve patients, the better they are able to make decisions regarding their health.
The diffusion of PHR-like apps among U.S. consumers is rapidly progressing. A recent study projected that the PHR technology is likely to achieve significant market penetration ahead of meaningful use goals. The best performing model indicates that PHR adoption will exceed 75% by 2020. Since the products will exceed the meaningful use stage before 2020, it is important for future goals to focus on the ambitious uptake, functionality, and high-level capabilities of PHRs. Nearly 2/3 of Americans own mobile devices and have become familiar with interactive services in other aspects of their lives. As reimbursement models change, clinicians will need to incorporate data from various sources to get a comprehensive picture of the patient's preventative health needs. This figure shows the projected diffusion patterns for internet-based personal health record adoption in the United States by year of introduction. As you can see, they project nearly 100% adoption by 2038 with varying start years. So where do we go from here? By linking PHRs with patients' electronic health records, there is the potential to further involve patients in all aspects of their care to help them more effectively manage chronic conditions such as diabetes. Some major features that most consumers want in a PHR are easy navigation, explanation of medical terminology, the ability to view their medical documents, test results, and medications, and be able to communicate with their providers, much of which we know PHRs are already able to do. Personal health records should include tools that enable patients to track specific measurements such as blood pressure, weight, or blood glucose, and then allow them to communicate these findings with their providers. Another valuable feature would be one that detects and notifies providers of patients' worrisome findings or patterns such as low blood sugars recurring at a particular time of day. From the provider perspective, it is important that messages be directed to the right person or department. About 2/3 of messages can be handled by someone other than a primary care physician, such as prescription refill or appointments, and this may help overcome physicians' resistance to implementation of the technology. More research is needed to better define functionalities that will be necessary for the personal health record, especially for the management of chronic disease. Barriers such as medical terminology, the digital divide, and privacy or security concerns may hinder PHR adoption. Increased consumer outreach and implementation of policies that strengthen privacy and security regulations may address some of these barriers. More education on PHR and its usefulness should also be encouraged. Interoperability of the PHR with existing EHRs will be beneficial to both the healthcare field and the public. To increase adoption and foster positive change in health behaviors, PHRs need to be universally accessible, user-friendly, protect consumers' privacy, and be controlled by patients themselves. Nurses can serve as strong advocates to engage patients and consumers and encourage PHR use. To get there, we have to place patients in the driver's seat. Nurses and nurse anesthetists have the opportunity to play a dual role in the adoption of PHRs as both a user and an advocate. As consumers, nurses have an understanding of the healthcare processes as well as the importance of access to accurate data. As knowledgeable consumers, nurses can assist patients to access online PHRs, encourage them to become more active participants in their care, and any misconceptions of PHRs can be resolved. Nurses also need to be actively involved in the design and development of PHRs. Using their clinical expertise, nurses can guide vendors in determining the layout of information in PHRs and incorporation of essential features. Nurses can also identify valuable information, decide which content is significant for care, and deem the appropriate level that the consumer can comprehend and gain the most benefit from the PHR.
Now that you have seen and heard all about personal health records, you may be interested in setting one up. It would be a good idea to check with your healthcare provider to see if they offer a connected or tethered option first. There are many different websites and apps that offer a format that you can enter your information in for a standalone personal health record. I'm just going to show you one option that Apple offers on iPhone, since most people have their phone readily accessible. You can find the health app offered by Apple by searching or finding this icon. If you have a fitness tracker, information can automatically be populated into the first screen, which shows your activity for the day. This example shows information from an Apple Watch. The next screen shows health data. You can input or locate information about activity, mindfulness, nutrition, or sleep. There are also apps available that can track these measurements and upload data directly into the health app. The next tab shows sources. This is where you can connect different devices and applications to upload information directly into the health app. In this example, MyFitnessPal and Mayo Clinic are the two applications that are connected. The connected devices are an iPhone and an Apple Watch. The last screen is a resource called Medical ID. You can put information such as name, blood type, organ donor status, and emergency contacts. When you put information into the Medical ID, people will be able to access this without unlocking your phone in case of an emergency. If the emergency SOS service is used, your emergency contacts will automatically be notified and will be sent your current location. Essentially, if you have Medical ID set up, this is how it works. When you go to unlock your screen, at the bottom left-hand corner, it says Emergency. You can access this without unlocking your phone. This is the next screen that will come up. You can make an emergency call without unlocking the phone in this feature. And in the lower left-hand corner, you'll see it says Medical ID. This is where you can find the information that you've stored on the health app under the Medical ID section. In this example, it says full name, birth date, organ donor status, and blood type. You can add as much or as little information to the screen as you like. This is just one option of a standalone personal health record. There are many different options out there, and again, you can have something as simple as a piece of paper that shows all your information. The important thing is that it's accessible to you when you need it, and you can easily customize it and use it yourself. With an electronic personal health record, you can access your health information from coast
To coast. Queensland, Australia, March 15th, 2018.
Hey there, mate. Dr. Wombat here. What seems to be the issue?
Well, I was scuba diving by the coral reef, and I think a shark bit me. So I ordered an Uber, and I sped here because it won't stop bleeding.
Oh gosh, yeah, that's quite a lot of blood.
Mhm.
Do you take any medications? Are you on anything daily?
Yeah, but I don't remember what it is. Let me get on my patient portal, and I can look it up.
That would be great, yeah. It's quite a lot of blood.
Yeah. Here, hold my beer for me. Yeah, so I take Coumadin, 1 milligram a day, baby aspirin every day, and a Flintstone vitamin every day.
Right.
Usually at night. But
What are you on the Coumadin for?
in 2005, I was diagnosed with a PFO, and then I got all these clots in my legs, so they were nervous that they'd go everywhere else.
Yeah, that's a concern for sure.
I don't know if you need to know this, but my INR, do you know what an INR is?
Yes.
Last Wednesday, before I left to come here for vacation, it was 4.1. So that sounds good, usually, right? I don't.
I'm happy to know that, yeah. And
I'll take this.
you've been drinking a little bit here.
Well, yeah, a little bit. I mean, I'm on vacation.
Okay. We're going to get you fixed up here. Thank you so much for your information. This is very helpful in your treatment plan. Thank goodness you have a personal health record.